The most important thing that the legislature can do for our aging population is what are the priorities that we put into the budget of the state. We fund the aging and disability waiver. We also fund the choice program, which is for home health care. And we fund FSSA for the Family and Social Services Agency for a lot of programs that have to do with our aging population. The cuts to the Medicaid aging and disability waivers in Medicaid have been very significant because the waiting list for those waivers is growing. As we cut the state funding available, that means fewer federal dollars are available and fewer people are being served with fewer and fewer services. And so that waiting list just continues to grow, and at some point we have to address it head on, and I'm looking forward to the day when we can fund A&D waivers to serve the needs of the people who need those waivers the most. As more and more of the population ages, as the baby boomers become senior citizens, and I'm in that class myself, then we are going to need to do more with the very limited resources that we have. As a matter of fact, over the last couple of years during the Daniels administration, there have been a lot of budget cuts to the choice program and to other areas, most recently in the aging and disabled waivers Medicaid program, and I think that those have been very harmful to families, particularly seniors and people with disabilities who are living in poverty. And so we have to be more vigilant. We have to work harder to make sure that we keep those programs flowing. But I do want to mention one thing that I've been involved in the last couple of years, and that is I've been working with a group of people who are very interested in helping our communities become more friendly, user-friendly, if you will, for people who would like to age in place. It's a new concept, really, talking about senior citizens not in terms of healthcare needs, but in terms of recreation, educational opportunities, work opportunities, making sure that our streets and our public buildings are accessible, those kinds of things. And so we call it Communities for a Lifetime, but it really is about helping our senior citizens and our communities work together to have the livable communities that where people can age comfortably and in place without being uprooted or institutionalized.